This is a really important concept here. So we think of Marfan syndrome, and I've seen a Marfan patient before. They have tall stature, long fingers, hypermobile joints, chest pain, palpitations, and this guy's got a ruptured artery. And they might ask you, hey, what is this similar to? Or what would this be seen in a patient with these large arteries? And so we think of myxomatous degeneration, and that means gelatinous or mucus-like is what myxomatous means, and happens when there are too many mucopolysaccharides, GAGs, that build up in connective tissue. It weakens them, makes them softer and more prone to tearing, which is what you see in Marfan's patients. So it's going to be similar to this process in Marfan's patients because you have a defective FBN1 gene, and fibrillin normally supports elastin fibers in arteries. And if you don't have those, then you can't handle the pressure very well if you don't have the elastin fibers. And so the body fills in the weak areas with the mucopolysaccharides, and that's myxomatous degeneration. Right, so the weak aortic walls get stretched out, and the stretching of those walls is causing an aortic aneurysm. So the weak layers can tear, and that causes an aortic dissection. And so yeah, that's going to be kind of the lay of the land here. Now, looking at our answer choices, A, we talked about this. This is Marfan syndrome, similar to myxomatous changes. And we'll just keep on scrolling down here for B. Atherosclerotic plaques with foam cells. This affects the medium and large arteries, but involves the plaques, not medial degeneration. Marfan does not cause atherosclerosis-related aneurysms. It's actually the fibrillin gene, so it's more similar to that kind of decomposition of the structure of the vessel. Granulomatous inflammation of the arterial wall, giant cell. Temporal arthritis, that affects older individuals, headache, jaw claudication, granulomatous inflammation, and it's not involving granulomatous inflammation. Onion skinning. This is seen in malignant hypertension, and that would be kidney damage. Fragmentation of type 3 collagen and berry, that would be Ehlers-Danlos. Type 3 collagen is Ehlers-Danlos syndrome. Vascular type would be 4. And so berry aneurysms can affect the brain and the circle of Willis. That would not be the aorta, so it's not going to be this guy, and nothing to do with your berry aneurysms, not aortic tears. So Marfan syndrome, weak aortic walls, cystic medial degeneration, and a risk of aneurysms and dissections. Hopefully that was helpful. If it was, like and subscribe for more content.